This is one of the most failed sterile skills, and most RNs don't realize when sterility is broken. I don't have all of the items listed here, but I'm going to show you exactly what you would need and how you'd use them so nothing is forgotten in practice. Now, remember, when you are dealing with the wound, it can come to you in any way, shape, or form. It may come to you with a dressing or no dressing, but you need to be prepared for what comes your way, all right? So, of course, you already know the basic: assess for pain, assess for allergies, and address those issues before you even start your intervention. With clean gloved hands, we're going to assess this dressing. I'm looking at it, I'm inspecting it. So far, there is no noted drainage on this ABD. I notice it is clean, dry, and intact. You can use an adhesive remover if you find it difficult to remove it. Some practitioners will actually use normal saline, depends on what you have, but adhesive remover is the most preferred in case it's much friendlier on the skin. All right, I removed it. I noticed, some serous drainage, and this is what I'm going to document. I put this in my biohazard bag. All right, I'm going to note again how much gauze is being used. I'm going to count specifically. This is still clean. Remember, there's different methods, safe methods to actually do a sterile dressing. Me, I prefer to do all of the clean activities first, and then I'll do my sterile activity. So I do 1, 2. Now, if it gets stuck, I don't want to yank this out. I will use normal saline. 10, 11. More? I'll put some saline here if I need to. 12. Okay, so what I do note upon assessment of this wound that there is some tunneling, so I'm going to measure the tunnel.
You do this while clean? How was that?
Clean. You can do this clean. You can also, if you choose, if you want to do this sterile, you can. Just note that after you do this sterile, you're going to have to change your glove again. All right, if you choose to do this in a sterile field. But I'm just doing this clean because it's not going to hurt the patient.
And you don't irrigate and stuff?
I'm measuring. You can irrigate. If you want to irrigate now, you can, and measure after. You can measure first and then irrigate. Either method is fine. Yes.
When you do the coca thing, are you just supposed to remember that?
You're supposed to remember that. Coca. You have to assess for.
And to remember the numbers.
Yes. Now, if you are like me and do not not Coca-Cola, okay? But if you're like me and don't have good memory, have your little notepad and then write it down. I'll choose to measure the tunnels first. I want to use the clock method. So I notice at 12 o'clock there's tunneling. Okay. All right. Boom. And then I'm gonna leave my finger here. And then it's about 3. At 1 o'clock, same thing.
Would you use a different one every time?
Yes, you can use a different one every time.
You can or you should?
You can.
Okay.
You can.
But it's not.
But you could.
It's not.
Okay.
No.
It's not sterile.
This is not a sterile. This part is not sterile. Now, if you were doing this sterile, then yes. Okay.
That's a lot of Q-tips.
Yeah. All right. Same thing. Measure. Boom. Now I also see that there's tunneling here around 7 o'clock. Okay. I'm also going to note the width and the depth of this. So one way I can measure the depth of this is to do like so, and then kind of like put my hand where the paper stops, and then again measure. That's about 2.5, and then the width, where the 0 is. This is about 10 centimeters long and about 8 centimeters wide. Boom. Now I've done my measurements. At this point, with the syringe and the piston, I will pour normal saline, flushing the wound. And I'm flushing until it's clear. All right. Now you would put, before you flush, remember you would put a chuck pads or waterproof pads underneath. And if the patient can, I will ask the patient to turn to the side if it's in a sacral area so that I can irrigate it appropriately. If they can't, we're gonna have to work within the patient's limitation. So if they can, you're gonna have to irrigate it, and you're gonna have to find, as you irrigate, yes. Okay. We always work within the patient's limitation, not within our comfort. All right, nice and clean. Now I'm going to go get my sterile kit. Okay? Remember, I'm opening my sterile kit with my clean hands, or if you want to use your gloved hands, it's perfectly fine. Before I open, I'm checking that everything that I need that is in this kit, I'm also checking for expiration date. And now, I like to make sure my area is as clean and clear as, or clutter-free as possible, so that I minimize contaminating my sterile field. Okay, so opening my kit. Remember, I cannot touch anything inside here except for the gloves that are on top. That's the only thing I can touch with my clean hands. And again, before I even went and touched my, open my kit, after I done my, my irrigation, I did wash my hands and I put on either new gloves if I felt it's necessary, or I just go ahead and use my clean hands, all right? So I can only touch these.
1 inch.
Okay, and this. Okay, that's the only thing I can touch with my bare hands, or my gloved hands if I want to use that. And I'm only touching here with my bare hands, like the edge of this container. And if you want to remove the top completely, you can do so as well. But you know, get into the habit of opening away. And remember, some of these fold back. To minimize them folding back, just kind of stretch it a little bit, okay? For pressure. Bruh. Sterile to sterile, I am just simply lifting this up.
Don't let it touch your wrist now.
No, I know.
Wash your thumb.
Everything's going in.
Take a step
Oh my
back.
God, where is?
Oh no, Semi's struggling. What are you gonna do?
Take your time.
Oh,
I can only touch here. My 1 inch border, and what I like to encourage y'all, an extra inch. So I'm gonna put everything in this little corner. All right, so you know, so I'm gonna pour all the solution in here. Now I'm gonna ball these up in here, but I'll separate them shortly. I just wanna make sure I don't touch the outside. So I am going to squeeze and separate right now in here. I wanna take my tweezers, but my hand is wet. They are still sterile. You have to actually re-glove because it is wet. If I go and put my hand right here, I've broken sterility. I could have just did this with one hand so I could have this, okay? But I didn't do that, so now I have to actually re-glove, okay?
Why? If it's sterile wet?
Because it's, no, if
Sterile
this
wet?
becomes wet, this no
yeah,
longer
you can't get
is,
that wet, yeah.
yes.
Exactly.
This is wet, so now I have to re-glove. I'm ready.
Oh.
Now, if there's any medication that is ordered, it is at this time I will put those the ordered medication. Now, if I want to, boom, I can do this. So that keeps this hand sterile. I'll try to avoid as much as possible touching the sides. Does that make sense?
Would you drop
Yes.
with your hand into the wound and then pack with the tweezers?
Yeah, that's what she did. But
No,
you have to, tunnel first.
Like drop, you have to tunnel first.
I think.
So you're talking about do this? Hold on, you're talking about do this?
Drop it and then push
And
it.
then push this in?
Yeah, are we able
Yeah.
to do it?
You're allowed to do that, that's still
I was
maintaining.
thinking something different.
Yeah. I
And
haven't
you're allowed to
broken.
touch the tweezers into the The one itself.
So I'm not touching the tweezers. So
You're just-
2. She has PTSD from first semester. You see, I let the tweezer go here. I'm not touching the tweezer with this hand. Okay?
Or you can drop it in the wound and then, like you said, your patient.
Okay, sterile procedure maintained. I am done. Now I can resume to clean
How many
measures.
guys did you put in there?
6. Remember when you putting the ABD, you can put it either horizontal, okay, or vertically, okay? And remember, when you're taping, again, your goal is to not have any lifting, okay? Just press down. And then the last thing I'm going to do, and you want to avoid putting your tape on the actual dressing, just put it on the tape, okay? If you hesitate, assume contamination and restart.